tough time, make a rough and tough mental health. Your vast experience and contributions to nursing education and research have added immense value to our webinar. We are sincerely grateful for your time and sharing your knowledge with us today. Moving forward, our next eminent speaker for the day is Dr. Bahubali Sir, Associate Professor and Head of the Department at Bharati Vidyapeeth Deemed to be University College of Nursing, Sangli, and also the IQAC and NAC coordinator of the institution. Dr. Bahubali Sir holds a PhD in nursing and MSc in psychiatric nursing and a BSc nursing degree from RGUHS Bangalore. With over 16 years of distinct teaching experience and clinical experience, he has served as a teacher, researcher, administrator, and psychiatric nurse practitioner in reputed institutions both in India and abroad. Sir has established more than 20 research papers in Scopus and index journals, authored 2 books, and also patented 3 innovative nursing devices, reflecting his deep commitment to research and innovation in nursing science. Dr. Bahubali Sir has been honored with multiple awards, including the Best Teacher Award 2023 and 2025, and continues to guide PhD and postgraduate scholars in advancing the field of mental health nursing. Today, he will be enlightening us on a very vital and essential topic: the role of mental health nurse in catastrophes and emergencies. We warmly welcome you, sir, and it's our privilege to invite you to share your valuable insights. Thank you, sir.
Yes, madam. Thank you very much for that insightful introduction about me. And at the outset, I would like to thank Vaishali Jadhav madam, Sunil Kulkarni sir, Parshuram sir, and all the organizing team of mental health nursing, that is BVDU College of Nursing, Navi Mumbai. Actually, is my voice audible? Am I clear?
Yes, sir.
Yes. Is the slide visible there?
Yes, sir, it is visible.
Yes. I'll just shuffle the slide. You please tell me whether it is getting changed. Yes?
Yes, sir, yes.
Okay, fine, fine. So everything is set for us now. Yes. Indeed, the topic of today, that is role of mental health nurse in catastrophes and emergencies. From the morning session I was listening to, and all the eminent speakers have made my job little bit lighter. As one of the speaker has spoken in the beginning about the magnitude of a problem, and then later Shiv Prasad Hademani sir had emphasized upon the impact of these emergencies or catastrophes on the human society and the country at large. And then later on, very beautifully handled session by Dr. Sunil Kulkarni sir, which was really a wonderful, insightful session to all of us personally, as well as it connects to my topic of today's discussion. That is, sir, whatever sir has taken the content of his talk, which is directly resembling to the preparation of a mental health nurse or a nurse who is going to be in service at the site of catastrophe or emergencies. So, in fact, I would like to conclude that the all the eminent speakers have made my job a little lighter in sense. So, having said that, let me just take you all to the path of today's presentation. I'm going to include very key terminologies which I'm going to make clear to all the participants to mainly to understand the intricacies and the differences between those terminologies. And followed by that, I'm going to talk about these catastrophes, emergencies, or disasters, how they affect the uh, mind, and then who are at the risk of developing such mental trauma. Okay, and what are the different factors which influence upon readily bringing in the mental trauma, and whereas some are not getting affected as we take a intensity of trauma as due to certain factors that we are going to see later on, and then common reaction to disaster, then stages of emotional response during such disastrous situation, then common psychiatric responses by the public, by the individual in affected victim in during the time of disaster, and importantly, the nurse's role in dealing psychosocial problems of disaster victims. So these are the key terms which we need to understand the relationship between each other and what they are, in which way they are different from each other. So here, if you see the word emergency, emergency is always a localized event, okay, and which can be accident also, which demands immediate action, but it can be managed by the individual who is at the that site of emergency. Whereas disaster is something which is very larger scale event and which overwhelms the local capacity. It means it is not localized event. It needs certain external resources to be mobilized and to be brought into action so that the impact of disaster which has devastated the existing resources of that community can be restored and very well operated in order to recover the damage or loss. So definitely it needs external assistance. Whereas crisis is something, it is nothing but a business failure or action failure. Okay, and like it is making hard to come out of those loss which is happening, such as called as a crisis, which often requires a coordinated response from multiple team members. So, for an example, if you take a crisis, when treating the person, I mean, while entering into the community during pandemic, we all have observed like people are hesitant to take vaccination especially in a remote rural areas. They were having some prejudice and misconceptions related to such thing, and they were hiding or they're running away. Some was on the roof of a house, something like that. So this is a crisis situation for healthcare team members, because what intention they have entered into the ground level, and what is the response which they are getting from some of the beneficiaries of vaccination. So this is a crisis which makes the individual to think over it and come back to the table and chart out the solutions, and then it can be worked out. That is a crisis. Whereas catastrophe is another thing, the most extreme level of disaster beyond the means. If we allow it to happen, sometime it is very much difficult to reconstruct the damage which has occurred during the disaster. So it's very severest form of devastation which has occurred during the disaster, which is very much difficult to reconstruct once the disaster phase has got over. So it needs greater level of sustained support from all the stakeholders, as at a national level or state level, at community level, at family level, at individual level, what an sustained support which is necessary to rebuild the community which has lost its glory and beauty. So, to with these terminologies to introduce today's discussion, that is, like these catastrophes or these emergencies and these disasters are very frequently occurring worldwide, as well as particularly in India also. It is being estimated that around 65% of the disasters have been increased than compared to the previous history or the occurrences of disasters worldwide. So we don't know how far we are going to be without disasters. So every one of us have suffered one or other disaster or catastrophe, which has made us to feel for our growth or to come down with our intentions of mindset of growth. So in particularly, we are as Indians, we are more vulnerable for natural disasters and also as well as the man-made disasters. So there usually disaster come with lots of takeaway or I mean the things which we need into our control, we lose that control and our positions are lost. It creates a devastating effect, which can take in toll in terms of loss of human life, livestocks, okay, property and livelihood loss, which may occur, physical injuries and damages to the developed works. Okay, so along with relief, rehabilitation and care of physical health and injuries, psychosocial and mental health issues are also important and they need to be addressed, as it was evident in the previous discussions as well. Like psychosocial need or psychosocial care during the disaster situation and making the resilient mental health, developing a mental health to the point of resilience. It's very much essential for the public to survive in and come out of the disaster situation. So, as an whole, though the today's gathering is of like it's a amalgamation of all the nurses, particularly community health nurses and mental health or psychiatric nurses. So, if we have to say, the World Federation for Mental Health has given a special consideration and special position for mental health nurses in the campaign kit as a frontline providers. So where what the mental health nurse can do or serve during the catastrophes are we must incorporate mental health and psychosocial support strategies in during the emergency response. Then we also are responsible to deliver a psychological first aid as well as the clinical care which is necessary, then coordinate the referrals, then support communities and safeguard workforce well-being in crisis and catastrophes, because it's as equivalent to the mental health, and safeguarding the workforce mindset is also equally important, as they may get mental fatigue and they get tired and they start developing certain psychosocial issues. So it's equally important for a mental health nurse to take care of affected individual in the community as a victim, as well as take care of the other healthcare work team members or other workers who are tirelessly working in the disastrous or catastrophic situation. So this is the various phases of disaster which are depicted here. Once So here the emotions are actually promotive in nature. Yes. So here during the initial phase of before the disaster, the emotions are taken care in a way of promotive way. And once the disaster affects the area or community, there the preventive measure starts, and the high impact of preventive measures which can be seen within 1 week of disaster, and which also can take the phase of 2 to 8 weeks after the disaster, which can be said as honeymoon phase, because all the help and all the assistance which comes handy, and it is just like all the requirements and needs are met quite quietly and commonly, which makes the individual to feel like a pleasure, or they are taken care well by the assistance which has come out from their community. And then once the 8 weeks are over, then the curative phase of disaster starts, and there the disillusionment phase it is called as. Here the people are disillusionment is nothing but a disappointment due to the lack of the things which they are needed, or the quantity or quality or the what they need, it is not as per that. So that phase is called as the disillusionment phase, which begins from 8th or 9th week onwards till 36 months. So then after that, slowly, after curative, then the preparedness comes into action, and the preparedness starts for the next or the forthcoming impact of the similar kind of disaster. So restoration phase, which works out on the preparedness plan, and then during this, after the impact of disaster till the disillusionment phase ends, the stress management for the relief workers is also equally important, and we have to be vigilant upon that also. So the work of preventive plan, which is usually in the hero ends in the heroic phase, and the honeymoon phase, disillusionment phase, and restoration, it works out on the curative task. And then again, preparedness comes with the preventive tasks. And throughout this impact of active impact of the disaster, the stress management, which is very much essential, as I told earlier. So, talking about what happens to the individual during this disaster situation, there are two types of trauma which brings into action, and the individual gets collapsed. Why I'm telling you these all things are because maybe directly or indirectly this has been covered in the morning sessions, but we as a nurse who are taking care of a person or public or a mass in the during the disaster situation, we must try to understand our role. Like, we have to minimize this mental trauma or physical trauma as well. So there are physical and psychological trauma which can take place, and particularly to talk about mental trauma, which can produce a strong feeling of strong feelings and or extreme behavior in terms of intense fear or helplessness or withdrawal or detachment from the reality, lack of concentration, irritability, sleep disturbance, aggression, then hypervigilance. That hypervigilance is nothing but they are very much active to seek or going to happen as of now. So that tendency to keep watch on the things which are happening around in a hyper way or in a aggressive way. Then the flashbacks of the disaster impact, which may come into their behavior, and sometimes nightmares also can be seen. So, in different population, vulnerable population, what these trauma makes the impact among children, it creates fear, threatfulness, and feeling of dreadfulness. Okay, those can be seen. Uh, People who are at risk for mental trauma, here adults with substance abuse problem, they are very readily exposed to the mental trauma during or after the soon after the catastrophe which strikes in the community. Pregnant women are highly sensitive in terms of physical as well as um, mental susceptibility to experience a mental trauma. Then women with the small children or kids, teenage girls, those with significant loss of possessions, elderly people who have lost family members, and extremely poor people, or the family socioeconomic status is too low, or they are already a refugee to that community where the impact has occurred. So these are the very crucial factors which determine the mental trauma as well as the disturbance of mental health in the public during the disaster or soon after the disaster. Those factors which are nature of disaster, because if nature is so severe, so harsh, it is going to impact so severely. Severity of disaster, and then physical and psychological proximity of the disaster, then support system which is available as it was discussed in the previous session as well. What are the coping skills we do have? As it was told, once it doesn't mean that we should not be angry or we should not be sad or we should not be happy. We should have all the balanced emotions, but the situation appropriate. And we should use appropriate psychological defense mechanisms to control our behavior and express as much needed to that particular situation. So by that way, we can maintain I mean, if we have proper coping skills or defense mechanisms, then we can control our impulses or the emotions, and then we can have a happier life, or I mean, we will not be getting disturbed, or the mental trauma or impact of disaster is not that severe upon the mindset of an individual who has good coping skills. Then concurrent losses have happened. If the individual has lost again and again, the loss has occurred with several reasons, then that may also a provoking situation where mental trauma is fixed within the individual. Then previous experience, in which if they have experienced some dreadful situation, then the similar situation comes, it becomes a flashback like, and they tend to showcase severe symptoms, or severity of disturbance can be much more higher. Among adults, what are the common reactions to the disaster? These are the few common reactions which we must be aware when we are taking care, or when we are playing a crucial role in the disaster situation as a nurse. Then common reactions in children, which can be seen, as I told you earlier, that is the regressive behavior, nightmares, school-related problems, or fantasies that recreates in their mind to state as the disaster has never occurred. There is nothing, no problem at all. So such fantasies can be expressed by the children after the disaster situation, or after experiencing a disaster. In elderly population, after the disastrous situation, what they experience is they will feel psychologically loss of their personal possessions, because they are one thing is they are very much attached to those possessions sentimentally, as well as they also have felt that now what loss I have incurred, that I may not be able to replace again in a easier way. I have taken these many years of my life, that is 60 plus years, to build this, and I have lost it now, and it's very much difficult for me to resynthesize or recover this loss. So, due to these two reasons, where person is having a depression or emptiness in the mood and emotions, that is loss of personal possessions. There are Richmer and Miller has given the stages of emotional responses, namely the stages passes through by the individual emotional responses during the disaster also are resembling to the denial, emotional response, acceptance of the problem, and then positive mindset, which starts recovery. So in the denial, as a person obviously denies the disaster has come or not, disaster has hit or not. Sometimes those who were in the experience with a flood-like situation, or river flood in Sangli district, many individuals, those who were denying that to leave the household things and go out of the community, because they were denying the emotional reaction was the denial, which they were feeling like no, nothing is going to happen. If it happens also, I am capable to take care. Nothing, it is not going to be this much severe. So when it hit, when it took a few toll of a life, then the people realized that yes, we have to be. Then by the time the emotional stage of denial had passed on, and they expressed certain psychological emotions, okay, and expression of psychological feelings, and then they started developing a positive mindset to reconcile the loss. After acceptance, then they came to the recovery stage. So common, while handling this, or while these stages are passing through, when they stuck into any of these states or stages, a person tend to develop certain fixation, and that fixation may lead to development of certain psychiatric symptoms. And these psychiatric symptoms are the outcomes of negative psychological defense mechanism, or the psychological defense mechanisms are used too heavily, or in a negative way. In that case, these are the outcomes, such as it is estimated that a person, like 1 in 5 person who experienced a war or conflict, develop mental health conditions. Okay, and the common psychiatric responses to the disaster situation are The very common one is acute stress disorder, which may further lead to acute psychosis, or later on, it may, in a long run, it may take the individual to the post-traumatic stress disorder, which is commonly known as PTSD, which is very commonest form of psychiatric response in the field of psychiatric illnesses. Substance use disorders may increase. Then the commonest one is post-traumatic stress disorder. It is estimated that 30 to 40% of individual who experience trauma, they tend to develop, those who have mental illness, other mental illness, they tend to develop PTSD after experiencing such disaster. Then 10 to 20% of the rescue workers are also tend to suffer with this PTSD. As I was telling from the beginning, rescue workers are those workers, all the members or group who are trying to get into this disaster situation from the outside area and trying to help each other and help the victims and take them away from the disaster situation and try to reconstruct the disastrous community. So they are called as rescue workers. So that may be NDRF team, or that can be a nurses, that can be a doctors, that can be a social workers, that can be a psychologist. Okay, that can be the armed forces. So these all are the rescue workers. By seeing such scenario of disaster or catastrophe, such a deadliest scenario it becomes, that it tends to produce some kind of post-traumatic stress disorder among these rescue workers also. And 5 to 10% of the general population who has witnessed these situations of catastrophe, they also tend to, survivors of these catastrophes, they also tend to develop this PTSD as a psychiatric response after, or in a chronic period of time of disastrous impact. Even generalized anxiety disorder is another commonest thing. Then grief reaction, that is family violence, which also can be seen. Excessive grief reaction is the another psychiatric symptom or response which can be witnessed. So to deal with these all things, what knowledge and skill we must possess as a nurse, though it is a community mental health nurse, or a purely a community health nurse, or a psychiatric nurse. So all the way, what knowledge or skill we must possess when we are trying to enter into the catastrophic situation and care for the needy. So for that, we should have a knowledge of clinical reasoning. Okay, we must be able to distinguish what this public is trying to talk about and what is the uh, clinical attachment of this information given by the sufferers or victims to us to understand. Then psychological first aid. These are the, there are certain 8 steps of first aid, that is psychological first aid. It is very commonly known as PFA, that we are going to discuss in a coming slide. Then triaging, how to triage and how to distinguish the victims and those who may need a immediate or urgent treatment or urgent mental health addressal, who needs it, that can be identified and that can be subjected to the segregation of the severity of individuals who are affected with this disaster, and that is called as triage system. Then disaster preparedness, we should be aware or what precautions or what preparedness has been already done for this disaster which has occurred now. So that disaster preparedness idea, about that knowledge about that disaster preparedness to that community, which is already being done by the disaster team. Okay, that has to be understood. Data collection, we must be able to gather the information very quickly, vigilantly and detailedly in a given short period of time in order to frame the nursing care or nursing interventions. Education and advocacy, it is very much important, as this particular webinar has given all the opportunity to every nurse here, that to get educated, to get understanding about the role of nurse into this catastrophic situation, and at least if not detailed learning within this short span of time from the morning till now, it may also at least provoke the nurses to take up certain detailed course or diploma or certain certification course in these regards, so that we'll be equally competent to handle the catastrophic situation. Then we must be also knowing how to uplift and keep our resilience at the highest mode, and to survive and to bring in the survival help to the victims. Adaptability also has to be possessed. We cannot be so sophisticated. I work in ICU, so I need air condition all time, and I can take only care of one patient at a time. These things are not adaptable or suitable in the disastrous situation. So we must be able to handle multiple people, multiple casualties, multiple addressals at a time. So that we should be adaptable to that. And sometimes we may have to sleep at somewhere in the corner of a area in the society of that affected society. So we must be ready to equip all that. We may not take, we may not get sufficient water to take bath or to take care of our personal hygiene also during that service. So we must possess certain skills of adaptability and resilience during the service to the needy in the disaster situation. Then compassion has to be there. As a nurse, we are compassionate. Nursing itself is a compassion. So there is nothing more to say about compassion for the nurse. Then it's a teamwork. We must be aware how to work in a team. What is my role? What is we must have a clarity of that as well, so that we can discharge our duty and we can avoid the duplication of work and we can cooperate each other so that the work can be done in a effective and quick manner in the disaster affected area. We should take a leadership role also at a time. Okay, sometime, see, as an emergency, if we have to talk for some examples, during the aeroplane has taken off from the airport and it is midway and there is some emergency. Someone has developed a cardiac arrest in the midair. So we must take some lead as a nurse and we must know, usually we are taught how to give a CPR and then we must take that cardiopulmonary resuscitation knowledge and apply there as a leader. Don't wait for anybody to call for help. You go and take a leadership role. Such leadership role, or sometime we have to take a risk. We are unsure, but I am there. You can start working on that by thinking or by judging the scenario or the fourth. I mean the outcome which is going to happen. So if we are doing it for good, we must take a risk also. Then we must be able to handle the communication between the victims to the other healthcare team members or victims to the other shelter homes or victims to the hospitals referrals. All that communication we have to be vigilant, and observational skills are very much important. Actually, this is one of the attribute of a nurse, that is we must be very observant in our skill. Like whenever we enter at any area, normally also without any disaster situation also, when we go into some area, we must be so much observant that we can identify many things around there. And those are the subtle things which cannot be told or expressed by anyone, but we can observe those things. Then even knowledge transformation has to happen. Like we have to advance in our knowledge and we cannot be in a fixed place. Like we cannot limit ourselves. The mindset has to be learning attitude. So knowledge and these are the descriptions which are given there here. So these are the steps of psychological first aid. First one is approach. A stands for approach to the individual. Here, what these acronyms are: assist, 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 and in that A stands for approach the individual. This is the first step of psychological first aid, that is approaching to the individual. And how we should approach is introduce yourself and state any organization you might be affiliated with or from where you have come for their help. You must introduce yourself. Then you must be very polite and professional during the introduction. And remember to say please and thank you for each and every aspect which they express to you. And that is how you express a cooperation, gratitude towards the cooperation rendered by those victims. So find a safe private place to talk if possible to that individual who needs psychological first aid. Because see, as you all are aware, when the first aid is given, first aid is offered when there is a threat to the life. Similarly, the psychological first aid is actions or the interventions given by a nurse to mitigate the life-threatening situation due to mental trauma. Okay, so there, what we should do is we should target an individual who should get introduced quickly and express your affiliation or from where you have come for their help, and then make him comfortable and be polite and professional in your talk. Okay, that soft skills of communication should be followed, and then find a safe place to talk to them. Then, second, after you get that individual in the right place, then what you should do is the second step is stabilize their emotions, because due to impact of disaster they'll have certain reactions or the emotions which are reactive in nature, as we saw their mental trauma. The emotional or feelings and behavior are reacted in a haphazard manner or aggressive manner, and that should be stabilized first. So how we can approach the stabilization of emotions? That is communicating in a calm, warm tone, whatever the expression may be, however loud they are, however they are crying or screaming or whatever it is. But you as a nurse, be calm. Okay, still don't lose your poisonous. Okay, you be warm in your tone. Okay, the person might be in shock, so you may need to repeat yourself at a time. Don't be annoyed to repeat the things. Whatever you want to ask repeatedly, you may sometime have to ask that, because they are in a mental shock or thought block, or their information processing system has slowed down due to the disastrous or catastrophic situation. So you may have to repeat the question what you are asking to them. Okay, then ask for permission before you hug or touch them. Okay, see, the touch, therapeutic touch, what we call, that is a part and parcel of the psychological first aid. We have to use the physical touch, or sometime we may need a jadoo ka jappi. Okay, as Munna Bhai says. So sometimes we have to have such things to be performed to stabilize the emotion. So before we do that, we must take a help, or we must be like taken a consent or a permission. Then other S stands for serve their needs. Okay. So after you stabilize their emotions, try to understand their needs and try to identify those gap in the need right now after the disaster or catastrophe, and ask the person what they need. Don't assume what their priorities are. Don't ever be. This is a mistake which we do when we are dealing in an emergency situation, where we assume some things and we go on doing it. But of course, those victims may not need that. So we have to ask for directly, openly ask to the person what you need, what are your needs right now. Okay, but never assume and do something. Okay, and help them to find missing family members or friends during these needs, because the Maslow's hierarchy need also tells, once you fulfill a biological need, the psychological needs are ones which are very important for individual. By keeping all the things in mind, the support system of family is required, and they'll be worried about their missing family members. So try to re-establish a contact or connection of lost ones. Then other one stands for, that is I. I stands for inform them about the facts. Okay, don't ever hide anything. Okay, and don't give any false information. Give a factful information or factual information, which tells about, give them concrete information about the incident, and any relief efforts are underway. So give the accurate situation idea or awareness. This is the role of media as well, where media nowadays they project many things in a different way, but in fact during in the actually in the disaster situation that may not be the condition. So that should be avoided. Don't exaggerate the things which are happening. Don't spread the miscommunication or false information. These are the rumors which are very much problematic and troublesome to handle the disaster situation. So we have to inform them the facts, what are actually happened, what is the magnitude of loss has happened, and what are the health which are underway, what is happening around that community which is affected. So that factful information has to be shared. Support their story. Then next one is support their story, because listening to them, making them to ventilate their problem, that is called as catharsis, is very useful method in order to get rid of or to feel lightened by their emotions. So we must encompass the listening capacity and understanding capacity of those victims. Then last one stands for turn them towards future services. So once they get stabilized, they're emotionally stable, then we can start with other intervention, other psychotherapy or cognitive behavioral therapy or any medication if required. That that can be a later process. So this is what the psychological first aid is all about. Assist, that is approach the individual, stabilize the emotion, serve their needs, inform them about the fact, support their story, then turn them for the further services. Then you can undertake some referral, and you can put them into halfway home or shelter home, which is established just outside the disastrous area or within the disastrous area, and they can be treated for further management. So, this is one skill or one idea where the nurse should possess, that is how to give a psychological first aid. Then the other one is there are certain trainings offered by World Health Organization, many associations who are working for disaster relief and disaster preparedness. There are non-governmental organizations who are dedicatedly working or for these psychosocial training for the capacity building programs, as it was discussed by Shiv Prasad sir also, that capacity building is an ongoing process which needs to be strengthened in the absence of disaster, and when the disaster situation strikes, then we that team who have been take undertaken certain training of capacity development, they can come into action and the impact of disaster can be lessened. These are capacity building tools also which are available. World Health Organization and NIMANS, or central government, that is Ministry of Health and Family Welfare, has taken numerous steps in order to make the psychosocial impact of disaster lessened or the less impactful. Then there is a manual which has been established or developed by National Institute of Mental Health and Neuroscience, that is NIMANS Bangalore. Um, that is harmonizing personal, professional, and familial life stress management workbook for the workers, care for the care providers. So coming to the crux of our today's presentation, that is the role of a mental health nurse in catastrophe. By having these all skills, knowledge, idea about what disaster causes, the impact upon mental health and psychosocial needs, how the psychosocial needs are disrupted, and what deficit or the void which has been created to fulfill that, we come into action, and we can discuss this role into three different headings. That one is preparedness part, that is pre-disaster or before the disaster occurs. Um, so what we can do here is public education activities. It must be ongoing. It means that whenever we are going into community area, there is no any disaster situation right now. But when it comes to the specific point of time in a year, where that common particular disaster is commonest, then you must have some educational activities in the community area. You should teach them how to survive, how to take care, how to shift, how to make oneself safe, how to make oneself culturally and psychologically stronger. That is what sir had told in the beginning. This is more of the preparedness activity which sir has taken in the earlier presentation. So life skill education, disaster mental health, like what are the expected changes which may happen in the catastrophic situation, how they should take care of themselves, and how they can help others. These all things can be understood through public education activities in the community area. Then other one is disaster response network. That is DRN team, which is always working for the disaster and its related preparedness. So we can also collaborate in this venture of initiated by government agencies or non-government organizations or community health workers, or we ourselves can also establish a response network, disaster response network, with the help of these agencies. So there is disaster response training of trainers can be conducted, that is TOTs can be planned, disaster mental health aspect, first aid training, okay, both medical and psychological first aid. Then counseling skills in the disaster situation, stress management, identifying common mental disorders and referral, then life skill training. These things can be undertaken under disaster response training for the trainers. It means the one who is qualified into the disaster management area, about these topics, he can educate a general nurse or a community health nurse in order to take care of a individual or victim in the disaster situation with these topics. These are the mental health topics which can be included in the preparedness, that is before the disaster occurs. These topics can be covered as a training. I mean, we can also take a training under these headings and we will be equipped or ready to respond during the impact phase. So also what all things can be done as a preparedness are psychoeducation regarding mental health in trauma disaster for the general population, community level support, and strengthening information education and communication activities, which was already also informed. Then immediately after the disaster or during that honeymoon phase to the back of immediately after the disaster, that is heroic phase, what can be done there is being part of the multidisciplinary relief team, we can have a rapid assessment because here the impact has occurred. That is a heroic phase. You are a hero entered there to take care of those victims and make equipped to those survivors so that they can also be a workforce to you in the immediate serve to the victims who are really affected, those who need assistance. The unaffected people can be taken into consideration by quick training, and that we need to do a rapid assessment. That is also called as mental health surveillance. Who are tough with the mind, who are weak with the mind. That you should be able to segregate very quickly by observing their behavior. So you can understand what is the need which is required. Need assessment can be done. Then providing health care. Okay, it is one of the primary duty immediately after the disaster because this healthcare or physical or medical support also can prevent lot of mental trauma or mental frustrations and violation of I mean exhibition of abnormal behavior can be minimized. During disillusionment phase, as I told you in the beginning of phases of disaster, that is disillusionment phase is nothing but people during until this honeymoon phase, after the heroic phase and honeymoon phase, within the honeymoon phase, they get enjoyment. They get all the care which they need. They're pampered. They are lot of emotional sensitivity shown towards these victims and they feel they are cared, they are wanted, and whatever they ask for, they are getting immediately. All this pondering happens in the heroic and honeymoon phase. But once that honeymoon phase of 36 months, if it is over, then the actual disappointment phase which starts with. So providing care for the mentally ill patients, okay, because here in the disillusionment phase, you will see real psychiatric disorders, which can be also witnessed. Apart from the acute phase of illnesses, there may be those acute phase illnesses are not attended properly, not successfully addressed with psychological first aid or with primary treatment, then they may land up into the major psychiatric disorder. So here the psychiatric management or mentally ill patients, we can term them, that situation comes into action. Then we should have continued on expanding capacity building activities during this phase. Here, the capacity building of those victims can be undertaken. Then training of resourceful community members like private physicians who are working into that community or primary healthcare staff nurses or paramedical staff, school teachers, workers, those who are involved into that community area, they can be trained about how to take care. Then community outreach camps can be conducted. Okay, hand holding of the community health workers. That hand holding is nothing but teaching them, taking them along with. Then assessment of interventions and feedback mechanism should be established. Or sometime in the preparedness, it also includes about conducting a mock drills about the catastrophic situation and how to deal with that. Okay, so that everybody gets their role clarity and when it really needs, they are into the action. So nurses' role in dealing with psychosocial problems of victims. So nurses' role can be discussed under two headings. One is assessment and the other one is nursing interventions. Because we are integral part of rescue team or rescue operation team and we should act as a case finder for persons suffering from psychological stress. So, as a nursing assessment in terms of mind, mental health or psychology of a person, what all things we should focus upon? We should assess the victim for high risk to develop mental disturbances. So, who are them? Who are those people who are readily developing a mental disturbances? As like I said in the beginning slides also, or those inclusively to those, there are some others which are added, such as those who have lost one or more family member in this catastrophe, suffered serious injuries, lost their home for possessions, then suffered a pre-disorder stress. Okay, they have already a psychiatric disorder, and this catastrophe has perpetuated the current existing mental disorder can create a lot of scenario where they need actual care. Then those who are poor or no fixed income and elderly individuals or member of minority groups. So what we should assess them is within this population is victims' behavior you check, okay? Precipitating events you must understand what has triggered this particular behavior. Okay, perception of event, support system, coping resources, previous trends, coping mechanisms, degree of impairment, then identifying the negative feelings. Okay, because these are very much high at stake in the disastrous phase, because we have to understand that anybody's frustration, anybody's loss, sudden loss, without informing there is a loss which happens due to the devastating effect of disaster, it brings a lot of negative emotions, and that negative emotions leads to a negative judgment, or in a way which feels that the individual is powerless, worthless, hopeless. Okay, all that. Guilt, fear, frustration. These are the negative emotions at the paramount in the situation. So we must assess for those negative emotions. What are the basic principles involved in this assessment are interventions to be uniquely tailored, because they are not similar to the other area. Disaster or earthquake has one type of response, psychological response, and flood has the other one. So interventions to be uniquely tailored, appropriate to the stage of emotional response also. Our intervention should be curtailed. Then should work with families or groups rather than individuals. Survivors should feel valued as a person, and safety is important. This is very essential, because one who is surviving out of that disaster, they are nowhere, they are clueless, their friends, their family, their children, everybody has gone in different corners. So here, respecting that survivor, instead of not isolating him or not keeping him low with his self-esteem, we must always respect that person or value that person, so he feels wanted, and he may also contribute because he knows look and corners of that community area which is affected with the disaster. So listen with a concern whenever you are listening to them. Don't just listen or casually listen, but be attentive in your listening, because just listen as it is and interpret as it is, but don't be a judgmental or don't be prejudiced. Okay, be efficient in observing verbal and non-verbal behavior. That is what we must be keen observers. Make sure you are not giving false reassurance. There are certain very important aspects which we saw in the phases of disaster, that is stress management. Right from the impact of stress to the disillusionment phase, we must focus upon reduction of stress. So I have highlighted a role of nurse in terms of reducing the stress. What we must do is, as much as possible, whenever you are segregating the people at a shelter, try to bring each family member together. Don't divide them. Keep all those family members who are available together. Okay, and provide adequate shelter, food, and rest. Okay, promote awareness of what has happened. Avoid isolation of the person during shock and defensive retreat. So we must handle them carefully with psychological techniques of psychological first aid. After providing a security, assign small supervised tasks to reduce tension and field work. That is what you just can't take care of an individual. Those who are, you feel that yes, he is stable psychologically or mindset is stable, he's enthusiastic or proactive in his action, ask him or give him certain supervised task. He can do that. Okay, so that by that what happens is he'll reduce his emotional response. His thoughts will be limited about the impact or about the loss, and he may not go into stress. So he'll be just worried and engaged actively or focused actively in the task which is given to him. There are other general interventions which are including make allow him to contact with his relatives, okay, outside his community area, and let him talk to them, let him be informed about the happenings in this affected area, okay, and then also give importance or important information about social, financial, health, and other resources. Then establish a communication network within the survivors, encourage individuals to share their feelings and support each other. There are certain specific interventions which can be employed by a nurse in the disaster affected area, that is to reduce stress. One is educating, crisis intervention, problem solving, then advocacy, referrals. Okay, referral is a very important measure which you will be taking care, because once the patient is referred or taken out of that community area and referred to the required health center, then the individual stress may come down. So these are the crisis intervention we must keep in mind. Like basic techniques are ventilation. Ventilation is nothing but allowing a person to express his emotions and feelings. Okay, and by listening to him and by giving him warmthness while listening, that gives him or her a lot of free or ventilate from their mindset or congested mind. Then active listening, empathizing, rebuilding support systems, spirituality, externalizing, relaxation, recreation. These are the basic techniques can be used as a crisis intervention. Special techniques include fact, thought, reaction, that is debriefing session. That is famously known as CID, critical incident debriefing. Okay, CID. C stands for critical, I stands for incident, D stands for debriefing. So that is how the first one is ventilation, and the ventilation has to occur their feelings and emotions. And meanwhile, we must be very active listeners, empathizing, active listening, rebuilding support system. Okay, these are the important things we must focus upon. Then spirituality and religiosity is also essential, because these are the faiths, these are the beliefs of an individual which comforts him during the loss. Or sometimes they say, I don't have anybody right left right now. My all family members have died, but God is there to support me and help me to come out of this situation. So this is how the religiosity and spirituality plays a role, where it is a belief system which strengthens the psychology of an individual. So externalizing interest and feelings such as anger or certain frustrations can be a part of externalizing the interest or feelings. Relaxation and recreation is equally important for those individuals who need to, especially in disillusionment phase and honeymoon phase, where relaxation and recreation are essential. The other point is critical incident debriefing, that is CID, which includes 5 phases. One is factual phase, thoughtful phase, reaction phase, teaching phase, and re-entry phase. Fact phase is first thing has to come to the debriefing has to happen. Debriefing is nothing but um, externalizing the inner information, inner thoughts. Whatever comes into mind, express it. That is allowing the unfiltered thoughts to express by the victims. That is called as debriefing. That is critical incident debriefing. How the incident has happened. They are going to narrate. They are going to express their thoughts related to the incident. That is why it is called as critical incident debriefing. In this phase, each participant is involved to share his or her perception of the incident. Okay, how they feel, in which angle they are perceiving the incident which has happened as a catastrophe. So let them express. Thoughtful phase, that is a reflection of one's own thoughts, what we are trying to say or what are our feelings are all about. That reflection has to happen. Then reaction phase. Here, the participants are asked to evaluate the impact of emotional aspect of this particular incident. Previously undiscussed and less accepted feelings are allowed to emerge in a safe environment. And knowing that others are experiencing the same feeling makes them realize that these feelings are normal for me also. So I'm also suffering, it's nothing new. So that has to happen as a reaction phase. Teaching phase, in order to targeting upon the stress and anxiety and to make to promote a relaxation, we must teach on a specific cognitive and emotional strategies. Re-entry phase, the facilitator encourages the question from the public or a victim and summarizes the process. Third is problem solving. Fourth one is like this is how we will come across with minor to major problems while we are serving the needy. So we must be equipped in order to understand the nature of problem quickly and suggest a possible solution in a no minute of time. Then the other role which we importantly play is a advocacy role. So advocacy role is nothing but one who is, see, the victims of disaster or when who are the survivors in the catastrophe or who are injured in the catastrophes. Okay, they may not be able to express openly what they need because their mindset has deprived from the expression of those needs. So what we must do is, as a nurse, we must realize what is their need and we must make sure that they are fulfilled with that need from ourselves directly, or somebody else can help them, ask them or beg them or take from them and give it to the needy person. That is the advocacy role which we must play during the catastrophic situation. Then the other important point is noting or understanding who can be referred and who can be treated there in the community itself. So making referrals is one of the primary role where we as a nurse maintain in the disaster situation, right from impact to the disillusionment phase. The referrals are required because if you feel that the individual who is already having a psychiatric disorder or those who are having substance abuse disorder, they need referrals. They need to be taken care by making them institutionalized care. Okay. Recognize their needs and help to link them with an appropriate treatment resources. So, in in summary, uh, the disaster impact brings some risk. Like from the nurse, it expects some response, and it also expects some recovery measures. It also brings a nurse at the stake of strategizing certain interventions by keeping in mind about development and mitigation, and hence taking up some steps of preparedness which really makes the public to be ready to face for the next coming disaster. So, as a general nurses, as a community health nurse or mental health nurse or psychiatric nurse, we can play important role not only in providing mental health services following a disaster, but also we can be instrumental in helping the community to identify the remaining resources. Okay, I may not say existing resources because the disaster has already caused some disturbance into the existing resources. So the remainder of resources can be utilized. Then training volunteers for disaster assignment or conducting debriefing sessions and counseling to the victim. These are the very important role nurses play in the phase right from response to the development. So these are some dreadful catastrophes, emergency, such as been see the children who are suffered with a mass burnt. Okay, or this is the left side is about flood situation. See the boat. It is not a boat actually. It is a remaining stem of a banana. plan. So by that they have made the boat. So this is, we must be equipped. We must be ready for this. And as a nurse, we are very much important in a healthcare team member who are the rescue team members and respondents for the disaster situation. That is why we must understand disasters keep coming. Okay, and we must be realizing that we must take up certain role of through capacity building programs, and we must take certain certification or training courses to strengthen ourselves and to educate others. That is TOT trainings and all we have to take into consideration. And because there is a need for personal, professional, policymakers and public commitment to emergency or emerging issues. So it's on this platform, I take the opportunity to express that I urge to Indian Nursing Council or to propel the training of trainers courses in relation to the nurses and disaster situation, in particularly about the mental health care system and disaster situation. So, which can strengthen the positive mindset in the preparedness. And when it comes to the execution or acting as a nurse in action, we will be more effective and more secured and ourselves, and then we can safeguard the other individual. As in the last session also was discussed, if you take care of yourself, you will be able to better take care of others. So this is how we must strengthen our side, our knowledge, our learning system, our skills should be sharpened through training of trainers, and then that can be disseminated at the decentralized level to the other fellow nurses, and they also will be equipped to face or to render their nursing service at the disaster affected area. So role of a mental health nurses is going to be engraved in a deeper rooted way in the disastrous phase. Then we must realize the importance of preparedness before the disaster hits, because preparedness has got a lot of impact upon the outcome of disaster. Okay, preparedness prevents many losses during the actual disaster. So preparedness is important. Then community focused interventions are necessary. How to develop a strength in the community, how to make the community united, what are the strengths, how we can strengthen the resilience. Okay, these things can be community focused interventions can be devised. As the NIMANS has done very well for patient consultation, I was about to ask another question to the authorities or nursing department of NIMANS. That is, uh, have they done anything for the disaster situation? These all teleservices or the digitalized services. What are the services available for disaster situation? There are. Telemanas is a very beautiful platform to get psychological help. Then, other than that, if there are any case consultation services which are rendered during the disaster situation, this is a question which we all must answer. Advocacy and innovations are inevitable for nurses, and nurses are at forefront for the advocacy of a needy people. And we must try to do something in an innovative way, which can really strengthen the resilience of the community and it can protect the individual. So with this, I come to an end of my discussion so far, and I would like to express a thanks for all the listeners because your patience listening was crucial in my presentation. So now the time comes is for very important aspect of our discussion. That is, any doubts, we can ponder the discussion. If there are any doubts, any clarification, which we can discuss upon.
Thank you so much, sir.
Thank you so much, sir.
You had covered
You
all the
had covered
points.
all the points.
So we request all
So
the
we request all
participants,
the participants,
if they have any
if they
doubt,
have any doubt,
they can ask.
they can ask. Yes. Is there anything which I can address to? Because I believe in more than PowerPoint presentations, the discussion would bring out many outcomes, and the purpose of very webinar, national webinar, would be fulfilled when there is healthy discussion and appropriate contribution from the participants in terms of questions.
Yes, requesting all
Yes,
the
requesting
participants,
all the participants,
please ask if you
please
have
ask
any doubts,
if you have any doubts,
if you want to
if
contribute
you want to
anything.
contribute anything. Hello.
Yes.
Yes, sir.
Yeah, good afternoon, sir. Yeah, no, sir. Hello.
Yes,
Hello.
sir. Yes, sir. Please.
Yeah.
I don't have any
I
doubt.
don't have any.
I have to add
I have
something
to add something.
Yes, sir.
Yes, sir, sure.
like
Go ahead.
Go ahead.
that the
That
training
training
courses,
courses,
we have to
you
take
have
the
to take.
training. But instead of taking the theoretical training, we have to go for the mock drill training is the most important because the disaster situation is like